Hi, this is Colleen with the Douglas County Public Health Department, and just coming on here to give you a quick update of some new and interesting information regarding COVID-19 as it relates to Douglas County. I think first what we'll start off with are just a few statistics, most recent statistics as published by the Illinois Department of Public Health. In Douglas County thus far, we have seen 2,796 total cases of COVID-19. That has resulted in 44 deaths of Douglas County residents. Right now, our department is following and monitoring 148 active and close contacts. And just from the time period of August 1st to August 11th, we have recorded 54 new positive cases of COVID-19. Our 7-day rolling positivity rate here in the county as of August 8th is 5.2%. And currently we have 36.68% of Douglas County residents that are fully vaccinated at this time. Speaking of that, I want to just note, while through the end of August we still have vaccine clinics going on here at J600 2 days a week. Starting September 1st, we will just be going to 1 day a week. That will be, as of September, we will only be doing vaccination clinics at J600 on Thursdays, and that will include all three vaccines currently authorized in the U.S., those being Pfizer, Moderna, and J&J. So just keep that in mind. That will be reflected on our online social media sites. That will show those are the only dates that you can sign up for those clinics. If you've already had your vaccine and you want to verify, check information, or see something online, Illinois has now started a VAX Verify Portal. Illinois residents can go online. You log on to IDPH Portal, so it's idphportal.illinois.gov, and you will create an account. And once you do that, you can see any immunization records that you have that have been entered into the iCare system. So that's something for you to do if you need to show proof of your vaccination and you don't happen to have your vaccine card with you. That's another option for you. I'm assuming everyone is aware of the mask mandate that has been given for all preschool through grade 12 schools. That includes both public and private schools and daycare facilities in Illinois. Everyone that goes into one of these facilities, regardless of your vaccination status, is required to wear a mask. This would include students participating in physical activities and sports while they're indoors. They did note and make an exception that if those physical activities and sports are being done outdoors, a mask will not be required at this time. So that's something to be aware of. The plus side of this for students now that are vaccinated, if you are a student and currently anyone from age 12 and up is eligible for a vaccine, if you are a student or a staff member who is vaccinated, in many instances you would not have to quarantine. You would need to get tested just to make sure that you are not currently an asymptomatic COVID carrier, but you can stay in school and you can continue to do like the test to stay in schools that are doing on-site testing themselves and enforcing that universal masking. So that's something that helps keep unnecessary absences from school down. So that's a benefit to vaccination, as is the simple fact that if you are vaccinated, while there have been breakthrough cases of COVID, most likely due to the more virulent Delta variant, you are highly, highly unlikely to experience severe illness and require hospitalization should you contract COVID-19. So those are some pretty compelling reasons to be a vaccinated student and staff member at a school. CDC data, there has recently been an analysis of a considerable amount of current data, finding that for pregnant women, there are no increased risk of miscarriage if you get when you get vaccinated early on in your pregnancy. The miscarriage rate was literally the same as it would be regardless of vaccination. So no additional risk of miscarriage if you get a COVID vaccine in early pregnancy. What about late pregnancy? You might ask. Well, that data has already been done, and again, no risk, no concerns for any greater risk due to vaccination. And in fact, right now, clinicians are finding in Illinois and across the country that greater numbers of pregnant people are coming in having contracted COVID. So there is a strong recommendation by the CDC that pregnant people get their COVID vaccine as soon as possible to help keep you from being in that situation. I also like to talk real quick about something that we're working on. We're very excited to be partnering with the City of Arcadia. Mayor Jesus Garza in particular has been really helpful in helping us try and get set up we're going to be putting on like a question and answer informational session in Arcadia. It will be conducted largely in Spanish. We are hoping to help raise awareness and accurate information among the Hispanic community, but communities in general about COVID and about COVID-19 vaccines, about their safety and efficacy. To help us do that, Dr. Jaime Martinez from Sarah Bush Lincoln has agreed to be the medical expert that answers those questions and addresses those misconceptions and misinformation. We have not nailed down a specific date yet. We're still trying to work with Dr. Martinez's schedule and find out what might be the best date and time for everyone concerned. So once we get that specific information in hand, we will certainly be getting that information out to the public, but we welcome that. We welcome anyone interested in learning more about that. It'll be free, open to the public, and we will get back to you once we have more information. Another quick note, not COVID related, so here's a probably welcome break from that. Our emergency response coordinator, Hannah Smothers, has a really cute, it's called Ready Wrigley. It's a children's emergency preparedness series of lessons that helps kids in dealing with all kinds of emergencies that might come up. And she would love to come into classrooms and conduct those lessons. So if there are teachers or daycare providers or anyone out there that wants to offer that in their classrooms and facilities, please give us a call here. You can reach Hannah by calling the health department at 217-253-4137, and Hannah's extension is 1213. Beyond that, we welcome any input that you might have for us. If there's something we can do to help you out and keep you safe and healthy, I think you know where to find us, and I'll look forward to talking with you again soon. Thanks for listening.